I'm an American acupuncturist. My name is Trey Casimir, and I've been practicing for 20 years. Uh, my private practice has been in a little town in central Pennsylvania since 2003. My main teacher was Jeffrey Yuen, who is known for teaching pre-communist classical Chinese medical techniques. And I'm talking today to my colleagues especially, and I feel kind of uneasy about this because even though I've been doing this for 20 years, I don't think of myself as an expert. I don't think of myself as being above other people. But I do feel like I've got some insight into the coronavirus pandemic, and it seems straightforward to me, but I'm hearing confusion and some things that seem incorrect to me, including in the very useful American Society of Acupuncturists town hall last week. Somebody said something that seemed to me to be very plainly wrong, and so I just wanted to give my input and help you treat your patients, help you take care of yourselves, help you take care of your families. So the thing I heard that struck me as wrong is that this is a cold and damp condition, and it very plainly is a hot and damp condition. The Wenbing school described this sort of thing after the Chinese started living in big cities and started getting illnesses not just from the elements but from each other, from bad food, from bad water, from bug bites. It so happens here in central Pennsylvania I treat lots and lots of Lyme disease, and so in its acute phase this is a Wenbing illness. It's caused by a bug bite. It gives you these flu-like symptoms, and then it leaves you with a chronic lingering state, all of which are characteristic of Wenbing dynamics. So to prevent Wenbing problems, you want to focus on the lungs and spleen. You want to strengthen the lungs and spleen so that the spleen's digestive function, preventing too much accumulation of dampness, and the lungs' ventilating function, preventing too much accumulation of heat, are both intact. And then you also want to work on their connection to each other, work on their zheng qi. So any techniques you know for connecting lung and spleen qi. And then, although the Wenbing school, hot and damp conditions are mostly considered to be herbal medicine, they're very effective acupuncture and other techniques for dealing with these problems in either an acute or a chronic stage. And I mostly don't practice herbs, but you would be using things to clear heat and to keep people going to the bathroom, keep their bowels active. So, cold minerals and cooling flowers, and rhubarb is especially a central herb for the Wenbing school. It's cooling and it has laxative properties. But with acupuncture, first of all, you're going to identify the stage. So you got Wei level at the beginning, Qi level is next. There are various differentiations within the Qi level, then this blood level, and finally is the Yin level. So if somebody has caught this illness and is pretty sick, you can pretty safely go to the blood level, the third of the four levels. And points especially are going to include spleen 10 and liver 3 to move blood, because the idea here is that the heat has gotten into the blood. Then after that you can do pericardium points, 6 and 7, heart 6 maybe. And these are to deal with the spirit disturbances, the delirium that arises off of the fever. And a very important idea, and it took me a long time to figure this out, and my treatments became much more effective. When you're treating points where heat is accumulating, the heat is right at the surface. Heat rises. So you needle those points very shallowly. Normally if I'm helping somebody with insomnia or diaphragmatic constriction, I needle pericardium 6, I'm going to go down until I get the Da Qi at half an inch deep or something like that. But in this instance, you barely prick the skin for those points. And then finally, you would add some points to encourage spleen and lung function. So maybe spleen 9, maybe lung 6 or kidney 26, stomach 25 to keep the bowels regular, stomach 36 to just keep things moving, keep things going along. If the person improves and starts moving toward the surface, you would add some wind points, large intestine 4, small intestine 3, bladder 67, gallbladder 20, or bladder 10. And unlike the Shanghan Lun school, you're not worrying too much about pushing the person deeper. So even if a person is very ill, you can still do these superficial points associated with the Wei level. It's never too early to purge. It's never too late to sweat. Is a primary statement associated with One Bing school. The other thing that you can do, especially for a person who's having fevers or is very restless, is gua sha, especially at the upper back, you know, from GV14 to GV9, and then out to the shoulders, that big diamond on the upper back. And you'll know it's effective because probably the sha that comes to the surface will be bright red. And let's see, that's the main things I had to say for now. I'm sure you can contact me somehow through the comments, or I don't know YouTube that well, but I'm sure there's some way to contact me if you have questions. I would be happy to try to talk to you more. I closed my shop a week ago, and I'm practicing telemedicine. I have reached out to my contacts at the local hospitals to see if I can be included in their response to the COVID-19 wave when it gets desperate here. And I'm very hopeful that I'll get the opportunity to try our medicine out against this serious illness. But the only responsible way I can do it is in the setting of a hospital with their protective gear and their protective procedures. So I'm just staying closed right now so I don't become part of the problem. That's all. I hope you're hanging in there. I'm looking forward to my Trump bucks. I don't know about you, but I think we're all in this together. And yeah, and I'm looking forward to treating my patients when they get back into my office. All right, take good care. See you on the other side.